According to DHEC, the flu is spreading like wildfire in the state, but a respiratory virus among children is surging, overwhelming emergency rooms in many parts of the country, including right here at home. Well, joining us with more is Dr. Eliza Agrest, a pediatrician and medical director at Pelican Pediatrics. Thank you so much for joining us.
Thank you so much for having me.
So what is the virus that's showing up in hospitals right now?
So respiratory syncytial virus, or RSV, is a very common pediatric virus that we see pretty much every year. Unfortunately, over the last 2 years, we've actually had a lot less of it, mostly due to masking and people not gathering in large settings. But this year, it has basically come back on steroids.
Why do you think that is? Why is it coming back with such a vengeance?
So again, it's multifactorial. You know, viruses do tend to often have a seasonality where for a couple of seasons they're not as severe and then they get more severe. And I think during the last 2 years, because everybody was so careful because of the coronavirus, everybody was wearing masks, less people were getting sick in general because masks help prevent the spread of germs. Also, there were a lot less larger gatherings. And so a lot less people were spreading it then. So now it's sort of come back stronger because, number one, a lot of these babies haven't been exposed to it at all, but also because everybody's so tired of masking and smaller gatherings that everybody's kind of collecting in bigger groups and so are able to spread germs more easily.
So let me ask you this, because they say that you need to have the good bacteria to fight the bad bacteria, but do you think we were living in too sterile of an environment that now children are getting even sicker when they catch RSV?
I don't think we have information to support that kids are getting more sicker or that we lived in a sterile environment, but we definitely saw less viruses, which definitely primed the immune system a lot less in some of these younger babies. So now they are getting a little bit sicker. And
you're seeing such sad images of these little children, babies in these hospital beds hooked up to all kinds of tubes and wires and all kinds of things. So how serious and how does this virus manifest itself?
So RSV is a common respiratory virus. So in bigger kids and adults, it's just a common cold. And very few adults, except for those who are older, get severely sick with it. But in younger kids, especially those under the age of 2, it can cause inflammation of the smaller airways and cause something called bronchiolitis, or inflammation of the bronchioles. And so that really causes them to have problems breathing. And babies, if they can't breathe, they can't eat. If they can't eat, they can't keep themselves hydrated. So they just kind of spiral down pretty quickly because they also have a very small reserve.
Now, we're also seeing this huge surge in flu cases as well. So running parallel to this, you're seeing some children that have both RSV and flu?
We have seen a few that had both RSV and flu, or both flu and COVID. Although it appears that flu A and RSV is what we're seeing the most of these days. And it is a little bit early in the season for both of them to spike compared to normal flu and RSV.
Is this potentially really dangerous for kids?
So RSV and flu can both be dangerous to kids, of course. You know, I don't think anybody should get extremely worried. I think having good hygiene, making sure if we're sick, we stay home. If our kids are sick, we keep our kids home because that's how we prevent the spread of disease. And obviously very important to make sure everybody has gotten their flu shot and everybody's gotten their coronavirus shot to prevent the spread of disease.
Dr. Agrest, I want to thank you so much for joining us.
Thank you so much for having me.
We're back in 2 minutes.